Okay, I'm getting ready and I'm gonna try and multitask and answer a couple things and respond back to a couple things while I'm getting ready, mom life. But, I just sucked in my hair. So a couple of people have mentioned this, that they feel like this is a conversation that the doctor should have with families and not the nurse. And many a times, this is already a conversation a doctor maybe has had with family members or patients. And as nurses, this is not new information we're getting to families. This is just information we're kind of reiterating. I will also say that it's been so busy with COVID over the last 2 years, and doctors are taking on more patients, and they don't have time to spend 20, 30 minutes with every single family member every single day of 30 to 40 patients. There's just not enough time on top of them writing their notes and, intubating patients and rounding on patients, assessing patients, and taking calls from nurses when things are changing. So a lot of times as nurses, we kind of have to carry this conversation to a certain extent and kind of be on the same team as the doctor and just reiterate what's already been written in doctor's notes, what the doctors have already been telling the families over the last couple days or weeks. So a lot of times this is not new information that patients' family members are hearing. We are just explaining and reiterating and maybe using, simpler terms to help them comprehend and understand what's going on. So if there's any big decisions that need to be made, like code status or, putting in comfort care orders and things like that, then of course the physician needs to touch base with the family. But as nurses, we can kind of facilitate a lot of these conversations to a certain level. Obviously, you don't want to overstep, and you shouldn't be having a conversation about making them a DNR and put that order in yourself without having a physician involved in that conversation. But if there's if there's ever a time you don't feel comfortable giving certain information to a family, then it's okay to defer it to a physician. You never have to tell them something that you feel uncomfortable with or that you feel is crossing the line. At my hospital, and I feel like in most intensive care units, a lot of us nurses are having these hard conversations with family members. And then, when it's time to make a decision, then a physician gets involved to formally have another conversation and make sure, everything's kind of squared away legally and per charting and whatnot.